Hey guys, thanks for joining me again. My name is Edith, and it's such a pleasure to have you all um, on today's presentation. Sorry, it's coming a little late, and that's because I've had a really busy week, so I needed to get some rest before I do this. So thanks for joining me. Today I'll be talking about HIV prevention or how to prevent and manage exposures to HIV, the virus, of course. Now, a few years ago, sometime in 2014 or 15, I worked in this clinic. It was an eye clinic, and we saw patients from all across the world, all over. So we had this international patient. She was a woman and she was in her late 40s. Um, she came in for diabetes. She had some really very high blood sugars, and she had a situation called diabetic ketoacidosis. So we kind of had to work her up and all of that to get her admitted into hospital. And then she also was blind. She had lost her sight. She came in and she had all these things going on. So, but in the course of the workup, we checked her for a whole lot of things that could have caused the blindness. And in the process, we realized that she had HIV. Actually, she had AIDS. Her viral load was really, really high, and her CD4 count was really low. That means she had had the virus for a very long time. So when we were asking her about her medical history, she had said that her husband died about 15 years earlier and she didn't know what happened to him. He just died. So we were assuming that he probably died of AIDS, and she had had AIDS all this while. She had all these opportunistic infections. She had so many things going on. So she had HIV, she had AIDS, and she didn't know it. So the reason I told this story is because we're going to be talking about HIV and AIDS in just a little bit. And this is just to create an awareness, because a lot of people out there are still involving themselves in very risky behaviors, sexually risky behaviors. They're sharing needles, they're doing drugs, they're not being careful at their workplaces. And a lot of pregnant women who have HIV are having babies and they're not taking care of themselves, and they're passing this viruses to their babies. So today I'll be talking about preventing and managing exposures to HIV and AIDS. Now, HIV is the human immunodeficiency virus. Okay, this is a virus. It attacks the body's immune system, and if it's not treated, it can lead to AIDS. So HIV is different from AIDS. HIV is still the phase where the individual has the virus. Is manageable. The person can live a very healthy life for the longest time. Now, where the problem is when this individual goes from having HIV to AIDS. That's where the problem lies. Now, there is no currently effective medication to cure HIV, but of course, there's been lots and lots of researches, and there are lots of medications out there that have helped people manage their HIV really well, and you wouldn't even know that the individual has HIV. Now, people with HIV can get effective treatments and can live very, very long, productive lives. So, having a diagnosis of HIV or AIDS is HIV is not the end of the world, not even AIDS. Okay, but if if the individual can manage his or her HIV and prevent it from getting to the AIDS level, then they can live a very long, productive, useful, fruitful life like every other person. Now, the only way you can know if you have HIV is by getting tested. You don't get HIV, you don't know if you have HIV by thinking that you know somebody that had HIV, or you had some sexual partners and you heard somewhere that they had HIV and you're not sure and you just conclude that you have it. You might not really have it. So the only way to know is by getting tested. some in 2017 16 I worked in this facility where I did mostly give injections to a couple of people. So I remember it was a lot of people for to be given medication injections that night. And one I remember one of the guys, I stuck him with the needle, and because he, I don't know, somehow the positioning wasn't right, and then I stuck him and brought out the needle, and the next thing, the needle went straight into my arm. But the good thing is it was a very little needle, so it didn't really get into the muscle or the bloody layer of the skin, under the skin. And yeah, immediately I freaked out. Trust me, I freaked out because I wasn't quite sure of the person's status. So honestly, I was freaking out. So but anyway, I got tested. I did all the stuff that I needed to do, and I was cleared. So I was really glad that he didn't have HIV, and so I didn't get it. So it's a lot of things that are happening out there, but the only way you can know if you have HIV or not is by getting tested. Now, knowing your status on time helps you to make decisions on how to prevent transmitting it, and of course how to manage yourself so that you can live a productive life. Now, there are symptoms of HIV which are like typical viral symptoms. When people have viruses, they have fever, they have rashes, night sweats, they have muscle aches, they have sore throats, they have fatigue, they have swollen lymph nodes. So somewhere maybe in the cervical area, right under your jaw, they might have swollen lymph nodes there. They could have mouth ulcers. They could have blistering. So they could have a couple of symptoms, but of course you do not diagnose yourself of HIV/AIDS without having to get tested. Okay, now an exposure to HIV is a medical emergency. The earlier you get to the doctor's office and get attended to, the better your chances of not contacting the virus or at least managing it. Now, there is something called pre-exposure prophylaxis. Pre-exposure prophylaxis, or PEP, is it should be initiated immediately, usually within 2 hours of exposure. So if you think you just had sex with somebody who has HIV, and then you realized, like somebody told me a story. I was asking her how she got to know she had HIV, and she said she had had sexual intercourse with this young man, and just about the time they were done, she flipped around and saw the bottles of medication he was taking, and that was how she knew he had HIV. But anyway, now, this medication should be started within 2 hours, but not later than 72 hours after an exposure. So the pre-exposure prophylaxis (PEP) should be started within 2 hours. So if you got exposed, maybe by sex or by sharing a needle or by blood transfusion, you need to see the doctor for pre-exposure prophylaxis within 2 hours, but at least not later than 72 hours, because the medication reduces its effectiveness over time. Now, assessment of exposure, HIV, and baseline testing can actually proceed after that. So after the pre-exposure prophylaxis, then you can start, thinking about, could you have actually been infected? Could anything have actually happened, and all of that. Now, for those of you or those of us whose occupations expose us to HIV/AIDS, in some way or the other, you have to follow measures to prevent you from contacting the virus. Now, if you don't have to share needles as much as possible, try not to do that. But if you happen to, be involved with blood transfusion, syringes and all of that, please try as much as possible to treat everybody like a potential carrier of not just HIV. It could be any kind of viral infection. It could be any kind of infection. So wear your hand gloves as much as possible, because sometimes I remember some time ago, I was called into a patient's room because he had pulled out his central line, and he was bleeding, like he was in a pool of blood in a matter of seconds. Yeah, when I got in there, the first thing I could have done was get right on top of him. But I realized that it could have been anything, okay? So I quickly grabbed my gloves, and of course, that protected direct contact with the blood. And I'm just saying this because you might never know. You might just go into the patient's room and you're just thinking about, oh, it's just a handshake. And then you get in there and you find out that there is something beyond a handshake. There is blood secretion. There is some mucus. There's body fluids around the patient that you have to touch. So it's always good to at least protect yourself. And if you happen to give injections, try as much as possible to also protect yourself. Now, factors that increase risk of transmission, source with known HIV who is not taking their medication or has incomplete viral suppression. The risk increases with high source of viral loads. So if you happen to have any kind of contact, sexual contact, you share a needle, or you have a blood transfusion from somebody who is not on their medication and so have a high viral load, then you have a high risk of contacting HIV. Now, if you happen to have sex without a barrier or some kind of protection, such as male insertive or female receptive condoms, you might be at a risk for having HIV. Now, the presence of genital ulcers and diseases or other STIs, sexually transmitted infections, can increase an individual's risk for HIV. So I always tell people, it might sound funny, but always turn on the lights, okay? Don't do anything in the dark. Make sure you see where you're going into. It's very important. So make sure you want to know, that your partner does not have an open ulcer in their genitals, because that increases the chance of transmission should the individual be a carrier of the virus. Now, trauma at the site of exposure. So if an individual is traumatized at the site of exposure, a wound or a cut or something, anything that actually compromises the skin integrity can expose the individual to HIV. Blood exposure. Now, this can be minimal and therefore not recognized by the exposed individual. But if the exposed individual reports frank blood exposure, you have to start a pre-exposure prophylaxis. Now, there's been a lot of studies about male circumcision being a high, male uncircumcision being placing the men at a high risk for HIV/AIDS, and that could actually be related to a whole lot of things that I'm not going to be talking about right now. But lack of male circumcision has been considered to be a high risk for HIV. Now, non-intact oral mucosa, so things like oral lesions. So if you happen to get kissing somebody who has HIV and has oral lesions, has wounds or ulcers in the mouth, without your knowledge, it could be something as a damaged tooth. A lot of people have gum diseases. A lot of people have, issues with their mouths, and they don't even know it. So if you happen to get in contact with somebody who has a mouth ulcer, a gingivitis, which is basically a teeth or a gum disorder, now that could actually increase the risk for HIV/AIDS. And of course, it's not limited to kissing. Of course, if you happen to involve yourself in any kind of oral sex or whatever with an individual who has a high viral load because they have HIV and are not taking the medication, that is going to increase your risk for having the virus. Now, there are some other exposures, but are not, these are considered very negligible. And one of them is biting, spitting on someone, throwing body fluids, including semen or saliva, and then sharing of sex toys. These are really, these are sources of HIV infection, but they are considered very negligible. Now, I already talked about pre-exposure prophylaxis. There's quite a few of them, and if you need more information, you can go to the CDC website. I'm not going to be giving you names of medications, just because that's not what the program is for. But if you want to know, you can send me a message inbox about the pre-exposure prophylaxis, and then I'll be talking about the post-exposure. So pre-exposure means before exposure. If you feel like for any reason you are going to be coming in contact with somebody who has HIV, then you need to do the pre-exposure prophylaxis. And then I'll talk about the post-exposure in just a little bit. Now, the pre-exposure prophylaxis is safe, but some people have some side effects which are typical, like diarrhea, nausea, headache, stomach pain, fatigue, and all of that. Now, but the good thing is these side effects kind of go away with time, okay? So if you feel like you're taking these medications and you're having some severe side effects, please let your doctor know. Now, if you have HIV, how do you protect others? And of course, how do you protect yourself? Now, the first thing you need to know, or anybody needs to know about protecting themselves after a HIV infection, is management. If an individual can manage his or her HIV, he or she can live a very productive life. And of course, it doesn't grow to the full-blown AIDS where they now have all these opportunistic infections that can kill the individual sooner. Now, if you have HIV/AIDS, or if anybody has HIV/AIDS, the best thing to do is get care and take medication. Take medications. I am being very honest. You will be so amazed that somebody looking very healthy, and all of that, has HIV. I mean, it's 2021, and these are things we just have to address as part of us. So it's not a crime to have HIV. It's just a crime not to be able to manage the situation, because anybody can have anything at any time. But of course, if you value your life and value what you represent, you should, as much as possible, try to take medications to at least contain it and preserve your life. Now, HIV medicine can reduce the amount of HIV in the blood, and these medications are called antiretroviral therapy, okay, or ART. Now, HIV medicine can make the viral load very low. So it means the viral load, the amount of virus in the body is the viral load, pretty much, for layman's. Now, so that it gets so low, the medication can reduce the viral load to a point where it gets undetectable. Okay, now people with HIV who keep an undetectable viral load or stay virally suppressed can live long, healthy, productive, beautiful lives. Viral suppression is defined as having less than 200 copies of the HIV virus per milliliters of blood. Okay. Now, if a person has undetectable viral load, they have effectively no risk, okay, of transmitting HIV to a non-HIV person through sex. So if you know anybody who has HIV and they are on their medications, as long as the viral load is undetectably low because they're taking the medication, those individuals may not transmit the HIV infection at that time. When it becomes really bad is when the viral load is very high. That is when the person can transmit the infection. Most people can get the virus under control within 6 months of starting the medication. Now, taking the antiretroviral therapy does not prevent the transmission of other STDs. So if an individual is taking the antiretroviral therapy and they have gonorrhea, syphilis, chlamydia, trichomoniasis, all of those, they can still transmit it. So if you have HIV and you're treating the infection, and then you decide to not protect yourself sexually, you can also contact or transmit other sexually transmitted infections. Now, for pregnant women, there are a lot of pregnant women who have had HIV/AIDS and have had HIV-free babies or babies with HIV/AIDS. Now, as soon as a woman gets pregnant, she needs to get herself tested to know her HIV status. That way, she can be diagnosed and treated as soon as possible and will prevent any kind of transmission to her unborn baby. Now, if the woman or her partner engage in behaviors that put them at risk for HIV, they need to be tested again. So if a woman is pregnant and she comes in for her first check, the first thing we want to do is check for STDs, HIV, and all of that. Now, if she feels like somewhere along the line she might have been exposed again, it's always important to test at the 3rd trimester before she actually has the baby. Now, she should also encourage her partner to get tested so that if they have to continue with sexual intercourse, the baby is not affected. Now, she has to take medications to also prevent the baby from contacting the virus. Now, there's pre-exposure prophylaxis. If she has a partner who has HIV/AIDS, HIV, but she doesn't want to get it, then she can take the pre-exposure prophylaxis so she doesn't get it and transfer to the baby. Now, the pre-exposure prophylaxis may be an option to protect the woman and her baby while getting pregnant, or during pregnancy, or even while breastfeeding. But of course, a woman with HIV should not breastfeed if she's not taking her medications, because HIV is definitely transmitted through breast milk. Now, after delivery, she can prevent transmission to the baby, just like I said, because the milk contains HIV if she's not on medication. Okay, so let me go fast into the last thing that I have, and that's actually the stigma. How do we deal with HIV stigma? I see a lot of people who are afraid to talk about their HIV status, and people who do not want to go get tested because of the stigma of HIV. Now, this is as a result of lack of information and awareness and outdated beliefs. Some people still think that HIV is a death sentence. Of course not. HIV is not a death sentence. Anybody can have HIV, just like anybody can have hepatitis C, hepatitis B. Anybody can have, we just all got through COVID-19. It's a virus. It's another virus. Okay, so having HIV is not the end of anybody's life. Now, this is not just a disease of certain group of people. It does not mean that the individual was sexually promiscuous. It does not mean that the individual was sexually irresponsible or did drugs and all of that. I've seen people who have gotten HIV even through sex. It doesn't matter. Okay, so but we should try as much as possible not to judge people living with HIV/AIDS, because they're humans and they have the tendency for living the best lives just like we all are living. And sometimes they even outlive a lot of us. Sometimes they outlive a lot of us. So please, let us all try to stop engaging in being judgmental towards the people who have HIV. Now, how can we avoid the stigma? First of all, we have to talk about it. We have to embrace it because it's among us. These people are among us. Now, talking openly can normalize the subject. So the more we talk about it, the more we get at least comfortable with it, and at least get to encourage those who have it around us. And then we should also try not to say things that can be destructive to people who have HIV or AIDS. Now, a very responsible sexual life can actually help us curb the spread of HIV. And of course, if you know your status, try to know your partner's status. If you don't know somebody's status, please, as much as possible, avoid any kind of sexual contact without protection. And if for any reason, you feel like in the course of an intercourse, maybe the condom busted or something happened, and you know or you don't know if your partner has HIV/AIDS, there is also something called the post-exposure prophylaxis. Okay, that's the PEP. Now, the PEP should also be taken at least within 72 hours of exposure, and that's very important because a lot of people have had this kind of exposure where they accidentally got exposed to HIV/AIDS. Now, this must be started within 72 hours, and it could be through anything, through sex, through needle sharing, or if you think you've been sexually assaulted by somebody you don't know their status, try to get the post-exposure prophylaxis so that it can at least control or prevent you from contacting the virus if the individual had it. So Thank you all so very much for watching this program. I hope we all try to live more responsibly. And if you have a diagnosis of HIV, I am very free. I'm available for you to come talk to me if you have any questions. And I want to urge every one of us around to please be acceptive and accommodative of our friends, families, brothers, sisters, parents, children who may have had HIV, so that they can actually deal with it the right way, and get the right needs, the right help that they deserve at the right time. So thank you all so very much for watching this episode of the program. Until I see you again, it's been wonderful talking to you. Have a blessed week. Bye bye.